is diagnosed with breast cancer in my program, I hear a couple things. One is, I'm a fighter and I'm going to beat this.
So, yon nan bagay mwen toujou tande le yon finwa gen kanser nan tete, li toujou di ke mwen son kombatan e map gen victoire.
Another thing I hear is, I'm afraid and I don't want to know the answer.
On lot bagay mwen kan tande, mwen pe mpa bezon konen repons yo.
And then the last thing I hear is, I've been diagnosed, I'm just going to let it happen.
E on lot bagay ke m tande, mwen deja konen mwen fe kanser tete ya, m jis ap vive avel.
One day, I was at the home of a black woman who speaks Creole, and she had been diagnosed with a very bad case of breast cancer. We got her insurance that we paid for so that she could get treatment. She refused to use it.
So, yon jou mwen te ale ka yon dam ki pale kreol, li te fe yon mouve stad kanser nan tete. So, mwen te ofril asurans ke nou ap peye pou li pran tretman e li te refuze tretman.
I called a conference with her husband, her children. I was at her home at 7:30 in the morning before she went to work.
So, mwen te rele konferans lan, mwen rele maril, mwen rele pitit li, e mte la kali depi a 7h30 nan matin avan li tal travay.
I tried everything, I said everything. I tried to convince her to continue on with treatment, that she had a chance, that her cancer was treatable.
So, mwen te fe tout sa ke mwen te kapab, mwen pale avel, mwen te ese konvenk li pou li te kapab al pran tretman paske nan stad li te ya, li te kapab trete.
They told me to go.
Yo te di mwen ale.
I don't know what happened.
Mba konen ki sak pase,
I don't know if she's still alive,
mba konen sil toujou vivan,
but she wouldn't take the insurance.
I pat vle pran asurans la.
That was free to her.
E li pat ap koute, li pat ap peye pou li.
Can somebody tell me what happened? Why? Why do you think that happened?
Eske gon moun ki ka dim pou ki sa l pense sa te fet?
Loss of hope? She said God was going to take care of her. Yeah. Yep. And that she felt she was betraying God or challenging God by using the insurance and just she needed to just pray it away.
Li te pense si li te fe sa, li ta insulte bon Dieu s'il te al pran asurans pou ta al pran tretman paske el te kwe ke bon Dieu te kapab geril.
Is that anybody's story here?
Eske sa se yon histwa pou moun la?
That if we are supposed to pray, we are supposed to trust God, we are supposed to feel assured and rest in His arms. We're supposed to do that.
Nou suppose kwe nan bon Dieu, nou suppose gen asurans nan men mon Dieu.
But do you believe that God has equipped us to do more? We do all that we can do?
Esko kwe ke bon Dieu ekipe nou avek tout sa ke pou nou kapab fe?
Okay. Then I need you to understand
Bezwen pou nou kompran,
that when there are resources to help us,
le gen resous ki kapab ede nou,
then we need to take advantage of it as much as we can.
fok nou pon avantaj de li tout autant ke nou kapab.
So let's talk about that breast cancer.
On nous parle de cancer dans tété.
There are at least 4 stages of breast cancer.
Il y a à peu près 4 stades de cancer du sein.
And we want to make sure that if we're diagnosed with breast cancer, that we act really fast on it.
Nous voulons connaître si nous diagnostiquons avec breast cancer pour nous agir plus vite que possible.
It takes 5 years for a breast cancer cell to show up on a mammogram.
Il prend 5 ans pour une cellule cancer dans tété paraître dans une mammographie.
Does everybody know what a mammogram is?
Est-ce que tout le monde là connaît qui ça qui est un mammogramme? Yes.
Okay. So, breast cancer is a tiny, tiny, tiny little cell that you can't even see with your eyes. You have to look at it through microscope.
Cancer dans sein, c'est une cellule qui est tellement petite, c'est avec microscope ou capable voir lui seulement.
So, one cancer cell, if you do nothing about it, will grow into 2.
Une seule cellule, si vous pas fait rien pour lui, la grandit en 2.
2 will grow into 4.
2 a grandi pour 4.
4 into 8.
4 là a grandi jusqu'à 8.
8 into 16.
Et 8 jusqu'à 16.
16 into 32.
16
32,
jusqu'à 32.
32 into, right. So you see what's happening? It's doubling.
So c'est doublé à chaque fois.
It takes 5 years for that one cell to keep doubling and doubling and doubling till it's big enough where you can see it on a mammogram x-ray.
So il prend 5 ans pour cette cellule ça pour doubler chaque année jusqu'à ce que vous capable voir dans une mammographie.
That's why it's important that you follow the routine in getting your mammogram every year.
C'est ça qui est très important pour nous suivre routine pour nous faire un mammogramme chaque année.
Year 4 of your mammogram, you may not see the cancer.
Dans 4e année on fait mammogramme nan ou capable pas ouais.
Year 4 of your getting your mammogram, you may not see the cancer.
OK, dans 4e année ou fait mammogramme nan ou capable pas ouais cancer.
So you skip year 5
Ou sauter 5e année
and you skip year 6.
ou sauter 6e année.
Now you at year 7.
Kounye la ou nan 7e année.
What is happening with that cancer? It has grown for 2 years, the 2 years that you skipped.
So, ça qui passe avec cancer ça, li vin grandi pour 2 ans que ou pas fait mammogramme nan.
So if you had gotten your mammogram every year, in year 5,
Si ou te fait mammogramme nan chaque année, sous 5e année,
we would have caught it at an early stage.
ou t'a gen tan connaît ça dans stade qui pi bonheur.
But if you wait,
Mais si ou tan,
does the cancer stop growing?
est-ce que cancer a campé grandi?
1,000 cells become 2,000 cells.
1000 cellules déjà vini 2000 cellules.
It gets bigger and it
Grandi.
grows
Li grandi et grandi.
and it gets nourished by your own body.
Et puis li ap grandi, c'est corps k'ap nourri li.
We have to stop it.
Faut nous camper ça.
But first we have to detect it. We have to find it.
Mais avant tout, nous supposons détecter li pour nous ka wè li.
Everybody understand?
Est-ce que tout le monde la comprend?
Okay. So I have a picture.
Tom gen yon photo.
This is what is inside of your breast.
So, c'est ça qui en dedans tete ya.
Women have lobes and ducts. Which is the lobes. Okay. These are the lobes, and the lines are the ducts.
Okay. So, ça on a regardé dans papier ça yo, ça ou c'est ducts and ça ou c'est lobe.
Okay. You could pass it around. Can you see it? What did it say? Are you laughing at my picture? Oh. Okay. So, women have lobes and ducts. What are the lobes for?
Pour qui ça yo là?
Say it louder. Yes.
C'est pour lait.
The lobes are for milk production. So, do you know that men can get breast cancer too?
Est-ce que nous connaissons garçon te ka fait cancer dans tête tout?
Do you know?
Combien nous qui te connaît?
Men,
Non.
oh, they didn't know? Men don't have the lobes. They don't need to produce milk.
Garçon pa gen lobe c'est parce que ou pas besoin faire produit lait.
But they have the ducts.
Mais yo gen ducts yo. Ça on a regardé dans photo ça là.
The ducts, men have what we call ductal carcinoma. Just duct,
Carcinoma.
right, duct
So,
cancer. Cancer
Garçon
of the ducts.
gen ductal carcinoma.
Right. Yeah.
C'est un
Yes.
c'est un type de cancer que garçon fait. Même j'ai dit fille fait breast cancer, garçon fait ductal carcinoma.
Right.
So garçon va le cancer tété pour garçon.
Women can have lobular and ductal carcinoma.
So fille capable gagner tous les deux.
You said that? Okay. All right. Yes. So, men have to also be careful and understand every day how their body feels and to take notice.
So garçon besoin connaître tout chaque jour comment corps fonctionne et pour lui
And just know their bodies.
et pour juste connaître corps n'importe ça ou senti qui différent la caillou.
I'm seeing the ages of some of the men. How many of you have heard of Richard Roundtree?
Combien d'années qui te dit?
He was an actor that played in a movie.
So Richard Gantry c'est un acteur qui
Okay.
joue dans un film.
I can't think of anybody else that's famous. But this was a man who was a famous actor back in the 90s who had breast cancer.
So c'était un garçon qui était vraiment reconnu dans l'année 1990 qui était fait cancer dans tête.
He's still alive today.
Il est toujours en vie jusqu'à aujourd'hui.
But he wasn't afraid to go to the doctor to get that cancer removed.
Mais il pas de peur pour aller dans le docteur pour être capable de faire retirer le cancer.
Right. So, I want you guys to understand that you have the two types of cancer there, the main ones. And when you check yourself, you see all that's inside of your breast.
So, moi, vle nou konnen, le nou al cheke nou gen deux types de cancer sa yo, nou gen tout sa yo an de nan tete ya. Si nou gade nan foto sa ki nan men nou an.
Okay. You need to know what's normal and what is not normal.
So, nou bezou konnen ki sa ki normal e ki sa ki anormal.
Some women breasts are very lumpy because they have a lot of lobes and ducts inside. Normal.
So, gen fi ki gen tete yo ki vreman like du, se a cause de duck yo, but se sa gen pou fili normal.
And some women don't have that. It's smooth.
So, gen fi ki pa gen sa tete yo vreman smooth, like, smooth.
Men can feel. What's funny?
The way I translate the word.
Okay. All right. Men have the ducts, and so they have to check their chest area often, not every day, but often, to see if there are any lumps or anything.
So, gase yo gen duck yo, fok yo toujou ap cheke pou yo wè si yo gen pati pousse nan l'estomak yo. Like the chest area.
I have a model that has cancer lumps in it.
So, mwen gen yon model la ki genyen boule kanser yo la dan.
Do you want to see?
Nou vle wè li?
Okay. Hold up your two fingers. And you're going to press on the model like this.
So, na kebe de dot nou pou sa, na suiv jan li ap montre nou koman pou nou pese nan model la.
And then you will feel the cancer lump.
E nap santi boule kanser a la dan.
I want one person to come up first so I can show them.
So, bezwen yon moun pou vini pou m kapab montre.
Is this tilt? No, it's not. It's okay. Come on.
A lump? Heart? No. M senti un boule bat boule la di.
And it's in one place, it's not moving.
Li rete one place li ba move.
So a cancer lump implants itself, it does not move.
So, yon boule kanser
Don't dig in.
li grandi, men li pa deplase.
Now, remember I told you that some women's breasts feel lumpy inside?
So, jem te di nou gen tete fi ki takou yo du an dedan.
You ever heard of cysts?
Nou jem tande pale de cyst, kiss.
We? Okay. Normal.
You have a question.
See.
She wants to know if it's a problem if it's hard, if it feels a lot. Yes. Di pa normal.
Abnormal. Not normal.
Di pa suppose du.
So let's talk about cysts.
An nou pale de kiss.
Normal. It's okay. Some women's breasts are lumpy and most times it's just cystic.
So, gen tete fi ki pare du, de fwa se jist son kiss ki la dan.
It's called fibrocystic breasts.
Li rele fibrocystic breast. Takou, ou gen kiss nan tete.
They are soft and they move around.
Li mou mais li toujours ap déplacé.
The difference between a cyst and a cancer,
Différence ki gen entre yon kes avec cancer,
cancer does not move.
le cancer a pas déplacé.
It's not squishy, it's hard.
Li pa mou, li du.
So if you feel something that's hard in your breast, it needs to be checked out.
Si ou senti yon bagay ki du nan tete ou supposé al checker.
If you feel something, men, if you feel something hard in your chest, behind your nipple where the ducts are, you need to check it out.
So pour garçon yo, si nou senti mon parti l'estomac nou du,
When
on
you
va
get
faire-
home. You doing it right now? Somebody does it every time. All right.
Good.
So, back to the cysts and back to the cancer lumps. You have to know your breast, you have to know your chest area, you have to know your body to understand whether or not it's been there the whole time or this is something new.
So, nou suppose konen kon nou pou nou konen eske sou bagay ki te la depi lontan ou bien sou bagay ki nouvo liye.
So, what if you check your breast and then you find something that wasn't there last month? What do you do?
E si ou cheke nan tete ou gen yon bagay ki pat la anfan, ki sa wa fe? Go to the doctor.
That's right. Yes. Don't play doctor, go to the doctor.
Ale nan kay dokter.
Remember, 1,000 turns to 2,000.
E pou nou sonje, 1,000 grandi jiska 2,000.
The longer you wait, the more it grows.
Plis sou rete ap gade, se pi plis la ap grandi.
Understand?
Eske nou kompran?
Okay, good. All right. So when you go to, if you find something and you go to the doctor and the doctor says, it's nothing.
So si ou gade, ou senti yon bagay, wal nan dokter, a dokter a cheke li di, se pa anyen.
What do you do?
Ki sa wa fe?
Absolutely.
Map chache yon dezem opinyon.
If you feel something and it's different, it hasn't been there before, it's your body, you get it checked out.
Se si ou senti yon bagay ki pa mache bien, ou konen kor, ou konen tet ou suppose al cheke li.
Right? You got a question?
Ou gen kesyon? He's asking if you're a doctor.
Oh,
He wants to know.
no.
Non li pa an dokter.
I have a master's in public health and I have
Okay, that's what he wanted to know.
no.
Li pa an dokter, li gen yon master nan edukasyon de la sante.
I was in nursing school for one semester, made all A's, and I said I can't do it.
So mte nan l'ekol l'infirmière, mfe tout a mpon sel trimès, mdi sa pa pou mwen.
I can teach it, but I don't want to touch it.
Mka edukel, but mbap mayen.
So,
Oh, she has a question. question si ce n'est la poser, comme je dis, c'est plus dans fille blanche que qui a cancer, mais plus fille noire mourir là-dedans. L'État me connaît qui ça qui cause ça, est-ce que c'est manque d'éducation ou bien est-ce que vous parlez d'un docteur exactement qui ça qui passe?
I want to answer the question with the story.
So moi je voulais répondre question ça avec une histoire.
I was at a mammogram event,
So m'étais dans un programme mammographie.
and a son rode by with his mother and saw our mammo van and stopped.
Et il y a un petit garçon qui était à maman, qui était ouais bus mammogramme nan, et puis tout lui campé.
She got her mammogram,
Li fait mammogramme ni an,
and the results came back that she had a very, very early stage of breast cancer.
et résultat te vini que li te gen yon stade cancer qui était très bonnet, pi petit.
It was stage 0.
Li te stade 0, pi petit stade là.
Within 2 months,
Dans 2 mois,
it had become, stage 2.
dans 2 mois,
Ah.
li grandi stade 2.
She had an aggressive form of breast cancer.
Li te gen yon cancer tete qui était vraiment agressif.
She had it treated, she's fine.
Li te traité, kounya li okay.
But in 2 months,
Dans
it
2
went,
mois,
it went from a stage 0 to a stage 2.
so dans espace de 2 mois, li sorti dans stade 0 pour arriver dans 2.
I've seen ladies that have a mammogram, black ladies who have a mammogram 1 year and there's nothing, and come back with a breast cancer in
So-
1 year.
Moi ouais fille qui fait dans fille noire qui fait mammogramme yon année et le retourner avec mammogramme. Avec cancer dans tête.
We go back and look at the reports. There was nothing there.
So nous aller à regarder report qui te gagné, yo pas gagné en année passée.
So I conclude, and so does a lot of research, that black women have a more aggressive form of breast cancer.
So moi je vais faire en conclusion et recherche montre que fille noire gagne yon cancer tête qui pi agressif.
Time? Okay. And sometimes it's a kind of breast cancer that's hard to treat, like triple negative.
So et des fois c'est un type de cancer qui est un petit genre difficile pour traiter.
Okay. So let me wrap up. I have to go. You have a question? What we're finding is that a lot of younger ladies are getting cancer more. The older ladies between the ages of 60 and older, it's the same rate. We are seeing women between the ages of 18 and 39 get breast cancer more than they used to. We don't know why yet, but I am seeing it in my office as well. I'm getting the last one was 25 years old with aggressive breast cancer. So I don't know. We talked about that earlier. We said it was diet. We said it was lack of knowledge, not getting screened, not knowing yourself. So I don't know that answer right now, but we are seeing it too. We're not seeing an increase in the older population. That's staying the same. We're seeing an increase in the younger ladies.
Okay. So, si se nou te go question li te mande, pou ki sa nou we gen an pil moun ka avec cancer qu'on est là. So, nous, ça, il m'a besoin de connaître ce que c'est dans manger, n'a manger, ou qui ça qui fait ça. So, réponse c'est que nous pas gagné une réponse pour nous dire qui ça qui cause les recherches pour qu'on baille. Mais nous voyons que de l'âge 18 ans à 35 ans, il y a plus de monde qui a gagné cancer dans la tête que l'on prend de l'âge 65 ans et plus. L'âge 65 ans et plus, là, stade l'arrêté de même. Mais dans l'espace de monde qui a 18 à 35 ans, où il y a plus de monde qui a fait cancer dans la tête. Et dans l'office, les gens qui étaient plus petits qui étaient diagnostiqués à 25 ans. 28 ans. So she wants to know at what age can young girls go do mammogram? If it's like, cause she thought it was 40 years old. So at what age can they go check that?
So let me explain why young ladies can't get a mammogram or should not get a mammogram.
So m'a expliquer nous pour quelle raison une jeune fille pas ta supposée faire mammogram.
Okay. A mammogram, women in their younger ages have dense breast tissue. So dense breast tissue shows up white on a mammogram.
So jeune moun gen ça qui le dense breast tissue. So le wal font mammogram li paraît blanc.
A breast cancer shows up white on a mammogram. So can you see it? No, you cannot.
Et cancer tête paraît blanc dans un mammogram.
You can't see it.
Ou pas ka wel.
Younger women should get an ultrasound, a breast ultrasound.
So jeune fille ta supposé faire une radiographie dans tête, pas un mammogram.
You can, if there's a lump, you can see inside of it.
So si gen yon boule là-dedans, ou capable wel dans radiographie.
We can see if it's cells inside or just fluid like for a cyst.
So nous capable voir si son cellule qui là-dedans ou bien si c'est seulement fluide qui là-dedans ou si son en kiss qui a grandi.
If there's a family history of breast cancer, you can get a genetic test or you can get what we call a screening MRI, which is very expensive, but you can get it.
So si vous avez une histoire de famille qui fait cancer dans tête, ou capable faire un test génétique.
So you have to know your family history, you have to know yourself, your body, and you have to not be afraid to go get it checked out.
So si vous connaissez histoire famille et aussi vous connaissez corps pour capable et pour pas peur à checker tête tout cas docteur.
Does everybody have this card?
Est-ce que tout le monde gagne carte ça? Si nous pas gagner sous table dehors, nous capable prendre le n'a sorti. Et ressources qui sous table c'est pour nous yo.
There's somewhere at the front.
Yeah,
Okay.
I just saw them.
Okay, good. So your federal tax dollars pays for the breast and cervical cancer early detection program. It is in every state. So if you have family members that live outside of Florida and they don't have health insurance and they don't have the money, the funds to pay for a mammogram, this program is in every single state.
So chaque état dans le pays a un programme qui permet de faire test pour faire première détection cancer dans tête. Li gratis tout state yo gagne. So gon famille dans n'importe l'autre state qui pas connaît ça ou capable faire connaître. So programme dans tout state qui est do capable faire test pour détecter premier stade cancer dans tête.
So if you don't have the resources, this is available. This is our federal tax dollars that are paying for this. We work for this, right? This is our money that's paying for this. So we need to take advantage of it. If you don't have insurance and you cannot afford it, then Tell your family in other states, tell your family in other cities, counties. It's available. It's available right here in Broward County. This is the program that I worked for the last 24 years.
So, resources sa yo disponible dans état na vivre là, spécialement dans Broward County, c'est l'argent que nous travaillons pour yo qui a payé yo. Si vous pas gain assurance santé, si vous pas gain ressources qui disponible, c'est dans ça que me travaille pour 20 ans qui sont passés à 20 ans qui passé là. So, il est disponible pour tout le monde capable de servir.
We pay for the mammogram.
Nous payons pour mammogramme nan.
If the mammogram's abnormal, we pay for the ultrasound.
Si mammogramme nan anormal, nous payons pour ultrasound, pour radiographie.
If the ultrasound's abnormal and you need a biopsy, we pay for the biopsy.
Si radiographie anormal, nous payons pour faire une biopsie.
And if you have been a U.S. citizen for at least 5 years, we will get you insurance that's no cost to you.
Si vous êtes un citoyen américain pour plus de 5 ans, n'a pas une assurance.
You will have the insurance for as long as you need treatment for the breast cancer.
Ou avez gain assurance ça pour tout le temps ou avez besoin prendre traitement pour cancer TTA.
Some of my patients have had the insurance for more than 5 years.
Moi j'ai patient qui gain assurance ça pour plus de 5 ans.
So, there's your resources. I have provided education. Do you have any questions?
So moi ba nous tout ressources yo, moi ba nous éducation yo, est-ce que gain une question?
Is it what?
There's a question here. Okay, so her question, how do the men know that they have to go check it out? Because they don't have breasts.
Well, most men have like really flat chests, so they can feel it right there because it's right behind their nipple.
So, tout garçon presque gen l'estomac qui flat, ou capable voir li pa derrière tété.
And if they feel something, they need to get it checked out too.
Et si yo senti un bagay, yo supposé al checker.
So, who is going to get their mammogram?
Qui est-ce qui pral faire mammogramme yo?
You did yours already? You did yours? All right.
I can help you.
Thank you. Here, just take the whole bag. Yeah. Whoever is old enough to get a mammogram. Unfortunately, the program does not pay for men to get a mammogram. It's only women.
C'est bien malheureux programme nan pa payer pour garçon, il paye seulement pour filles.
You got to talk to your congressman. Tell them to include men. I have lunch bags if somebody can answer a few questions.
Moi gen bag pour moun, excusez, oui ton bag là, sorry.
Who wants to? I need 4 people.
Besoin
Come
4
up.
moun.
4 brave people.
Besoin 4 moun qui brave.
All right, we got 1. We got 2. We got 3. I got 1 more. Come on. Come on. Woohoo. You got to stand right here first. You got to answer a question. Don't run. Okay, you ready? You want to go first? Sure. Okay. How long does it take for a breast cancer to show up on a mammogram?
Combien de temps il
Yeah,
faut
both.
pour breast
5.
cancer?
Yes.
Right. 5 ans. Right?
Yeah.
Sorry. Oh, you want me to translate? And okay. Li mande combien de temps li prend pour avant ou ka wè cancer nan tete a? Moi di réponse nan c'est 5 ans et li dit c'est vrai. And I said that's right.
Okay. Yes. Okay. You ready? Yeah. Who can get breast cancer?
Yo pose la question qui est-ce qui a fait cancer dans tété?
Okay, I say women and men can have breast cancer.
So, moi di ni fi ni garçon ka fait cancer dans tété.
Was that too easy?
Yeah. Another one. Another one.
Another one? Okay. At what age should, and I don't think I talked about this, but what age should a woman get a mammogram? Somebody mentioned it though.
Skip it. She heard the answer.
Okay.
Yes. Just say it anyway.
Okay, 40 years old.
Yo te pose une question, à quel âge on fit qu'elle fait cancer dans tété, elle fait mammogramme. Li répond à 40 ans.
Oh, I got a trick question for her. Should you get a mammogram every 5 years or when?
Est-ce que tu as supposé faire un mammogramme chaque 5 ans ou bien qu'il est supposé faire un mammogramme?
Every 1 year.
So, li répond chaque année.
All right. Where do men get breast cancer?
Qui côté garçon gen cancer dans tété?
Contact não sei. O conceito não sei. Não tete. Não isso. Yeah.
Comment li relé?
Little city.
Il m'a dit, le côté garçon gen tété, en cancer, comment li relé?
Como ele?
Oui.
Little city. Sim.
Simple.
Yeah.
Cincinnati.
Very city.
Oh,
Yeah.
he's in the breast.
Yeah.
So, est-ce qu'on ou songe photo ça? Ça on te dit comment ça te relé? Elle te dit ça? Ok, ça relé dans.
Dad.
The men. Who can help him?
Qui est-ce qui a aidé? Côté cancer ou fait cancer, comment le relé? Ok, I heard the last. Okay, stop. Now, like, quand on va gagner boule tété à vous sentir, on va sentir le moyen de chest là, non pas derrière pour tété, ça relé pour tété, on va sentir boule là là-dedans. Yeah.
Elvin, what you said, but that was fun. Thank you. Yay. Stay here.
The hardest question.
The hardest question? Okay. I didn't really talk about it, but what is metastasis?
That's a hard one. I don't remember.
I didn't talk about it.
I don't know it.
Okay. So, all right, let me ask you another one then. What happens if you, how many stages are there of breast cancer, and what happens if you don't do anything about it? What happens to the breast cancer? Give us a lecture.
There is 4 stage of breast cancer,
Et 4 stades cancer tété.
and if you don't do anything about it, you might die.
That's the question.
It's gross.
That's more of it. How about it just grows and then it's harder to treat?
How does it grow? Like everywhere? Is it double, triple?
Double.
Okay, ici gen 4 stades cancer tété et souvent il pour les licher ça toutes les chaque année.
Okay. So, are we okay with this?
Yes.
Okay.
So can you answer the question you asked me, the first one?
Yes.
What is
Metastasis. Metastasis is when, right. Come up here. No, okay. All right. What is metastasis?
It's when it spreads to another part from the original site or from the original cancer.
So you have 2 types. You have invasive and you have metastatic, right? Invasive means it leaves the original area and travels within the breast.
Okay, gen 2 types. So, invasive la veut dire li sorti dans centre côté lié a, li circule dans reste partie tété a.
Metastasis means that it leaves the breast and travels to the lymph nodes the lymph nodes are all over your body or in certain places in your body, but it's controlled by where your blood goes. So we don't know where that cancer cell may go. It may go to your bone, to the brain, but that's what metastasize is, and it's harder to, well, it's difficult.
So deuxième type là c'est metastasis. So let travel. So let spread nan corps, li ka sorti nan partie tete a, li séparé nan tout corps. Et la impacté module lymphatique là.
Right. Okay. Any questions?
Pas de question?
Thank you.
Thank you. I can keep this?
Okay, na baton gros bravo. Come, Miss Trevor. We want to say thank you so much for coming. And we know you take time out of your schedule to come and bless us. Thank you so much. We really appreciate it. Thank you. So baton gros bravo pour vous. M'da parlé de un miracle qui t'est passé. Quand m'da dit nous sister Gilles t'es dans emergency room. Last night bon Dieu fait il là ensemble avec nous malgré ça. Ouais, il fait effort de venir pas bon ici. So nous disons bon Dieu merci pour grâce ça. N'a continué avec service nous. Say Alina, you ready to do worship?
Okay. Okay. So, nous, chita longtemps, font y camper. Let us stand. À nous font y chanter. Nous mettons des cancers, nous pourquoi mourir. Nous mettons camper, nous mettons camper. Je ne mourrai pas, je vivrai. Je ne mourrai pas, je vivrai et je raconterai les œuvres de chanter, chanter. Je ne mourrai pas, je vivrai. Je ne mourrai pas, je vivrai et je raconterai les œuvres de l'Éternel. You may be seated. And nous avancer bossa, tout le monde avancer bossa, because we're getting ready for a panel discussion. So please, tout le monde avancer bossa. Everyone on this side. Sir Maggie, God bless you. Bon Dieu fait miracle. Yes. Et pendant qu'il a avancé, tout le monde qui fait partie panel là, nous mettons avancer là. C'est Gilles. Nous mettons chita là. Our panel, our guests, can you please sit here? Our sister, because I'm sure there will be more questions. Avancez, avancez. Hi Guy, how are you? Saluez une lot. Say hello to your friend. Saluez une lot. Gen nou qui vini là, nous pas saluer une lot. Say hello. Say hello, hello, hello. Say hi. And we're missing someone. We have a cancer survivor. Where is she? She left? Sefamon. Kotil. Oh, okay. So we have, okay. Comme si nous baladons. Traversez boy ici. Very informative information. Frappez main pour Sister Travell. Come on, give her a hand. Come on, we can do better than that. Come on, put your hands together. It will cost us so much money to invite someone like her to share these type of information. And tonight it's free. So thank you so much for coming out. We're very, very appreciative. Sister Famun, kote lot seno, because she would be the first one that we would ask the question. So let me be here so I can see everybody. Yeah. By the way, guys, it's Breast Cancer and Awareness Month, but it is also Pastor's Appreciation Month. Vous t'es songé ça? Put your hands together for our pastor, Pastor Ken V. Frappez même pour Pastor Ken V. Moi, ça, yo prend pour yo célébrer pasteur nous yo pour nous montrer yo apprécier. We have, okay. We have a breast cancer survivor, but no aptan ni vini. Nous t'avons mesdames yo introduit tête yo. N'a commencé avec Maggie Gilles. Just a short introduction.
C'est seulement qui Jules, quand une boy ici a déjà, nous sortis dans l'église baptiste Bethel, dirigée par pasteur Patrick Jules.
Ou marié, c'est Gilles?
Oh oui, I'm married, marié, le pasteur Henri Jules, on a 4 petites, 9 petites.
Wow, put your hands together. She's beautiful.
Praise God.
Man, I know, fi pa remen di l'âge yo. Mais on pa ka di l'âge yo.
Moi, je dis tout côté servante.
Okay, how old are you?
I'm 73.
Wow, come on, put your hands together. Come. Wow, 73 years
Oh
old.
yes.
Wow.
Wow.
Okay, next.
Hi everyone, my name is Sister Guylaine Jules. I am married to Pastor Patrick Jules. I have 5 children, and yeah, I'm the reason why she has 9.
Following her footsteps.
Okay.
So same last name, so I'm assuming she's your mother-in-law.
Yeah, she's my mother-in-law.
Okay.
Yeah.
Next.
Travelle McKire, and I have 2 children and 4 grandchildren, and I'm 65 years old.
Wow. Wow, very impressive.
Hello, everyone. My name is Nano Chevelon, Madam Pastor Kenvi Chevelon. I have 3 children, and I'm 39 years old.
Wow.
Hello, everyone. My name is Donata Mena. I had to make sure I say it right because I just got married and my husband said I better say my last name right.
So which one is the last name?
Mena.
Mena.
Before it was Norde.
Okay.
So it's Mena.
Oh, wow.
Vous connaissez français, yes.
C'est ça, Mena.
About Menard. Mena. But I'm just saying. I'm 45 years old.
Wow.
I do not have biological children, but I do have a bonus child that he have a son. Yeah, that's it.
So I'm assuming that's your husband.
Yeah.
Okay. All right. Put your hands together for our ladies. Frappez-moi nos pieds forts pour mesdames yo. And they share their age. En pile femme paraît me dit qu'il âge yo gagne. But son grâce, they look beautiful, right? Yes. So our first question. So because our sister, she shared about breast cancer. Guys, excuse my voice. I'm going to rire ensemble avec moi. And it was very cold, Pastor. Wow. But I can't blame it on the church. I got sick before that. So the information shared was very informative. And I heard a little clip that you are a breast cancer survivor.
Yes,
You are a miracle. Can you share a little bit of your testimony?
It's a long story. No.
Well, just be precise. Very short.
Very short.
Okay.
Okay, so you describe my whole story. I would honestly say that. So, since I knew my history, my family history, so my aunt, from my mom's side had, breast cancer. She passed away, unfortunately. My aunt from my dad's side had breast cancer and cervical cancer. They survived. So I knew my history young. So by the time I turned 12 and I had my menstrual, and my dad was very advocate about us seeing a doctor regularly. So my doctor always told me to do self-breast exam. So just like she was showing you, do it 1 week before you have your period, 1 week after, while you're laying down, while you're in the shower. So I used to do that a lot. So by the time I was 17, I got a lump. They took it out. It was benign. 10 years later, It came back, same breast, same location. I went to Jackson. I didn't have insurance. There was an Asian doctor. She did the ultrasound and everything else. She said, it's fine. Come back 6 months. Don't eat chocolate or drink coffee. Me being a hard-headed, I say, I'm not going through that. I want a biopsy. She didn't want to give me a biopsy. So I said, I'm not coming back to Jackson. So that will be 2007. So a whole year until I finally got a full-time job, 2008. End of the year, that's when I went to Nova, because they have a student doctor clinic. So I went there. They got my mammogram film. I went to get another, not mammogram, ultrasound film. I went to do another ultrasound. I had a Jewish doctor, Dr. Judith Schiffer. She's like, oh no, you're gonna get a biopsy. Did a biopsy. While the person was doing the biopsy, she was teaching somebody else, and she saw it, and she caught herself, because she was telling the person, that's not good. So, now that was the end of 2008. I didn't get my result until 2009, February. And when I got it, my friend called me. He worked at the clinic, but he wouldn't tell me over the phone. He always told me the result over the phone. So I called one of my friends, hey, come with me. And then I was diagnosed. My doctor told me that. And she's like, don't worry. I'm going to give you the best surgeon, the best oncologist. We're going to beat it. And that's what she did. So this search, I just started a new job, mind you. So I didn't have insurance yet. But I had to wait 4 months, did surgery, went back to work, and everything else. Waited, because they had to send that biopsy to California, waited to make sure. And I had to do a second surgery because the breast cancer cell had already spread. So I had it 2007, I felt the lump. I didn't get it out until 2009. So the lump had already spread as a tangerine size. So I was stage 2. So since it was active cell outside where the lump is, they had to do surgery again, clean it, they call it scraping. They scrape around, and then they took 4 lymph nodes, but it had already spread to my lymph nodes. So they took 4 lymph nodes, and then from there, I did chemo, radiation, and then I was in tamoxifen for 10 years.
Wow.
So I'm here.
Amen. Moun qui pas attendre anglais yo, fait sûr que mandon moun qui parle anglais bien pour l'expliquer tout ça dit. Même l'elle pas fini expliquer pour le bon petit idée. Parce qu'il n'a pas bien traduit tout. Mais lui-même il dit il te gagné ça l'elle te jeune et parce qu'il gagne une famille qui gagne trace cancer. So ça veut dire il déjà connaît faut le prendre ça bonheur. Bon proverbe qui dit pi bonheur c'est grand matin et c'est ça que fait il là à soir. Ou t'es perdu cheveux?
Yes, I lost my hair, everything, my eyebrows. Still, I don't have enough.
Wow.
I want to get that too, but my husband won't let me. But that's fine. But I just wanted to let you know also, it wasn't genetic. So even though my aunt had it, I did the Braddock test 1, 2, and I did another gene test.
Wow.
And it's not genetic. So mine was because I produced too much estrogen. But I never took birth control pills because birth control pills have estrogen in it. So I just naturally produce too much.
So speaking of the pill, let's go back to Travell. Can that cause cancer? Birth control.
Well, when I was in school, I was told that you don't take the birth control pill for a long period of time.
Okay.
Because they aren't sure how it works. But as she was saying, some cancers feed off hormones. So, and estrogen is one of those hormones that you can have an estrogen-based cancer. And, or you could have a cancer that is not hormone-based. That's what we call triple negative. So it's just it just depends. Cancers are not the same, so you can't blame one thing on the cancer. It could be different reasons why. It's different types of cancers.
Okay. Me pose la question, est-ce que une femme qui prend planine, est-ce que planine ka bali cancer? So gen des produits qui dans planine nan li ka cause qui au produit cancer. Mais ça pas veut dire statistiquement parlant, c'est ça qui cause cancer. Est-ce que nous d'accord? Okay. Are we done with the cancer? Okay, are you done? Okay. So, je voulais prendre un exemple de ça qui dit là il prend sa bonheur. Pasteur Ken vient dans une action de grâce. Une soeur qui te fait cancer. Docteur dit pour la prendre un médicament. So, il reste dans jeune pendant 2-3 mois. So, après, il fin faire 2-3 mois jeune, ils font une grosse action de grâce. Il relève sœur pour l'idor, mal l'autre bois, mal l'église là, nous font une grosse action de grâce, manger toute qualité bagaille. Oh, il délivre li. Pas même une semaine après, il mourit. Parce qu'il te dit c'est Jésus pour guérir. Les fait action de grâce pour Jésus, il toujours mourir. Où est la différence là? So ça veut dire it's very imperative. It's imperative. It's vital that we listen to our doctors. I said that we had a sister in Miami, Sister Travell. She had a Thanksgiving service. Doctor said she had stage 2 when she went to check it out. And she said she's going to pray. She's going to have Thanksgiving service. We did all of that. In fact, I led the service. And she died 2 weeks later. So just to compare her example, she took early. Yes, she believed in God, but she followed her doctor's direction. So it's imperative, l'important, même les n'a prié, mais après bon Dieu, c'est docteur, oui. Oh, ne mettez pas de amen. Après bon Dieu, c'est docteur. Tout bagaille, c'est gaz. Tout bagaille, c'est gaz, pasteur. Tout bagaille, c'est gaz à haïtien. Yo acheté dernier ces médicaments, produits naturels qui gagnent dans le pays pour gaz. Et puis les maladies envahissent les total. On nous passe avec c'est Gilles. Madame Gilles dit qu'on ça a 60 combien de temps? 75. 73. Wow. 73 ans. Elle mette kiki toujours. Look at her. Moi-même, je suis un petit kikit, regardez. Je suis un petit kikit, regardez, master. Viens camper là, c'est Gilles. Oh yeah. Look at her. Moi, je presque fini avec kikit, mais. Ouais. But you were in the hospital last night.
But you know what? I was in the hospital for my foot.
Wow.
Une histoire à vivre. Bon Dieu fidèle tout. Mais moi, docteur. Tout, il y a mal me senti douleur en bas pied. C'est pas parce que je mettais talon, non. Parce que j'ai un problème dans le pied déjà, quelques années de cela. J'ai une boulette pied qui. Je ne peux pas finir à raconter, mais le docteur te dit qu'il a coupé les jambes parce que je me fais sucre. Je dis, docteur, dans le nom de Jésus, je ne peux pas couper. Je dis, moi-même, je ne peux pas couper. Il dit, je coupe 25 pieds déjà, Magui, pour la couper. Je dis, docteur, je pour retourner, et tout, pas, je ne mets talon encore. Je dis, docteur, je pour retourner dans l'office, la côté, avec talon dans le pied, ça a 7 ans.
Amen.
Je saute quand le docteur parce que je sorti en bas plate, je connais l'on fait, il faut veiller, quoi elle dit, même l'on a prié, c'est moi qui aime la prière, mais il faut veiller comme. Faut veiller corps, faut veiller tout petit symptôme. Je senti en bas plate, je un problème, je aller au docteur. L'aime pas de cas de docteur, mais là emergency on bras général. Pendant la texte docteur, non moi dit que dans la coupe et il me bras général, me venir pour pied me cap bon problème. Il dit Magui wait. Il texte moi back, il dit me pour venir côté mon office là, konya là, il bon minute temps ti m'a venir côté, pas rentrer l'hôpital là non, m'aller côté, konya bon mon rendez-vous mal on pédiatrie pour pied moi lundi. Mais ça qui bagaille pour moi, m'geta écrit ça fait nous dit m'pa ka venir ça, si dal pas te gen douleur dans pied. Depuis matin me lever m'pas senti grâce douleur.
Amen.
M'te dit fait nous pas venir, m'pas capable, mais bon Dieu.
Amen.
So t'a dit ça m'a dit sœur Guylaine pas senti aucun douleur. T'es pensé m'pas pas dans vie non, c'est que bon Dieu fidèle.
Yes.
Bon Dieu guérit moun que le vle, Jean le vle, mais faut nous al kay docteur. Moi me believe dans docteur.
That's right.
Yes.
That's right. So, Anu Kapela, so you're a pastor's wife. How do you keep up with your family, church, and the marriage?
La Bible dit comme ça. Bon Dieu, famille, l'église. C'est moun qui si tellement care pour l'église moi, mais en même temps tout femme qui pas mariage pas dans tout.
That's right.
Parce que être bien si tellement fréquent, et pas deux divorces moi même Maggie Jules dit le pas divorcer. Nous sommes célébré 48 ans de mariage moi.
Wow, 48 years. Come on guys. She's celebrating 40 years. 48.
48 ans.
Wow.
Et servante, moi son moun qui connaît yo connaît busy parce que je suis femme de prière. Je toujours à prier, je toujours dans le service, à visiter malade, à l'hôpital, dans le nursing home, tout bagay, mais tout bagay est important.
That's right. So, c'est Maggie Gilles. So, dit tout bagay est important. Ça veut dire tout bagay fonctionner avec pasteur.
Tout bagay.
We still, nous toujours dans tia
Bon, vous connaissez. Bon, si c'est pour moi, because me, I don't.
That's just a joke, guys.
On fait parler sur Anita. Et moun yo connaît ici parce que yo connaît me kon parler. Bagay comme ça me pas négocier.
Oh,
I don't.
nous pas voulons poser question. Maggie Gilles. She said she doesn't negotiate that. So it doesn't matter how old she is, she's going to take care of business.
Parce que bagay ça ken bon en santé.
Oh.
Amen.
Oh.
Il connaît ça. Anita, vous connaissez mon yo concernant Maggie. Sujet ça pas même parler de lui parce que I love that.
Oh, she loved that subject, guys. Listen, guys, that is part of living as well. Ou pas qu'à seulement faire l'église, ou c'est madame pasteur à chanter et puis Maria ou pas prendre soin. Ça important tout. Wow. That's why she looks so beautiful. Okay, she got it going, guys. Ouais, mon yo levé, oui. Yo t'a dormi, yo levé. C'est pas bagay moun remetande là, non? All right. We have a whole discussion going back there. Okay, that's enough. Next. Nous prenons Maggie Gilles. Okay, I know check jeune moun yo. Guylaine, since you're married to her son, how is it when you are married and your husband is a pastor, you're under the leadership of your pastor, which is your husband, and your father-in-law? How do you balance both of them?
I stay out of it. I just stay neutral. There's certain things that, you just can't enter. Get back out come I didn't grow up in a pastoral family, so there's a lot of things that are new to me. There's a lot of things that are, very different. Gampil bagay ki nouveau à moi-même parce que m'pas grandi dans famille like pastoral que moi que yo fait face avec yo. So, y a quelques bagay lem moi yo, m'pas comprendre yo m'prier. Et puis, y a quelques bagay just, they eventually figure it out, So there's some things I meddle in or I have to say something. Others I pray about and I just kind of leave them to deal with it.
I agree. Parce que c'est important. On va toujours joindre, par exemple, pasteur Kenvi, si moun yo a grandi, on les pasteur Kenvi pas capable encore. Et puis petit li ka marié, et puis yo tout en bas pasteur Kenvi. So ou gen belle-mère, ou gen beau-fils, ou gen belle-fille. Faut nous connaître comment pour nous agir afin que l'elle pas là pour ministère capable toujours continuer. Et c'est ça qu'a privé dans l'église Bethel, nous gen c'est Guylaine qui marié avec petite c'est Maggie, yo bien vivre et li en bas pouvoir ou bien en bas ministériel Maril avec toute bopel avec toute belle-mère. Son belle bagaille, pas vrai? So, we ask that. Est-ce que vous avez une question pour des gens qui sont parlés là dans l'assemblée? Anyone with a question for Sir Maggie? You lost it? Oh my God. Oh no, I'm going to ask you guys too. You have to interact. Oh my God, I hope you remember. Okay, if you do, just anyone else? Comment qui a question? Okay.
I love Mommy Jill so much. But my question is, m'ta reme konnen ki jan de vitamine ou pran? Parce que m'ta reme rete nan stage. Le moui, parce que m'soti nan l'âge miye, m'komanse tired, you know, parce que m'bezwe kek, Bam no vitamine yo, mami.
C'est pour garder qui vitamine qui bon pour keep you up. Il faut arrêter ou prendre jambe. Parce que lorsqu'on mari commence à agir, mesdames qui commencent à agir, faut lever, faut ranger corps parce que jeunes mesdames yo pas jouer. Et ça mari yo besoin prendre dans monde. C'est pas menti non? Si ou même vous pas arrêter jambe pour keep up, en pile voler de a besoin pour mari pour là.
That's right.
C'est pas menti non?
Mesdames, ouvrez les yeux nous.
Ah, ouvrez les yeux.
Ouvrez les yeux nous et puis tendez avec ça et nous.
Et puis Jean nous mettez corps nous tout mettez toujours bien brodé, toujours senti bon.
Yes.
Toujours. C'est pour mari moi c'est pour le mari Jean te problème te jeune toujours habillé. Moi m'habillé, moi mais toujours élégante.
That's right.
That's my life, OK? Ça veut dire servante en pile travail pour faire. Et puis moi de bon Dieu direction.
That's right.
Et premier bagay, est-ce que me fait mari plaisir? Est-ce que parce qu'on arrive l'âge que des fois messieurs ne doivent pas faire genre capable faire l'autre petite activité.
That's right. Ah ouais. Quelle est nous pas attendre? L'autre activité oh. Nous parlons parabole, vous comprenez parce qu'il y a un petit monde là. L'autre activité, l'autre yo. Pasteur Kenvi, il y a des gens qui ont un problème là, vous parlez de ça. Ou pas de un problème, c'est un bagage, c'est bon Dieu créé le même. Depuis vous avez une licence pour lui. Vous comprenez, il faut avoir une licence pour lui. Madame Kenvi, continuez avec ça, c'est Maggie qui commence à parler. Comment pour qu'un corps en tant que femme, parce qu'elle est toujours belle. Depuis que je reconnais tout, ou toujours propre, ou toujours mettez radou clean, ou son madame pasteur qui propre. How do you keep up? Do you keep up with your doctor's appointment? Your teeth is beautiful. How do you do it?
That's a tough one. Peut-être même toujours can be beautiful, but I will try. Même get trois timon c'est vrai, but timon yo pour aller marier après tant de kaila ensemble.
That's right.
Take your tête. Un son madame avant ou te maman so ou toujours voulait qu'elle marie à la caille ou pas le voir elle dehors toujours faire exercice pour se faire notre mène vient faire exercice ensemble avec nous jouer water pas quoi non grand pays pour offrir un pas capable gen côté qui va aide ou calé parfois tout les nous aller dans mall yo mandé nos email nos bagay ça yo c'est pour les gen sel y a voye coupon bon nous ka acheter un bagay qui te coûte $100 nous ka acheter la $10 $19 toujours les yo aller dans mall yo mandé nos email c'est pas pour l'autre bagay yo mandé puis yo ka voye coupon là wal non store yo tout lisa wa acheter yo pour connaître ça, on mettre dans le corps. Parce que l'or, les bagailles, c'est très bon pour connaître ça, on mettre dans le corps. Et puis manger healthy.
Right.
Ça, c'est pas manger, but I try my best to eat
You're beautiful.
healthy.
You're beautiful. You're beautiful. Yes. So it's very important. Yes, sometimes we go to the mall and they give us these coupons and all these different ads. But you know what? You use it when you need it.
Yes.
You're not forced to use it. You're not obligated. But you use it when you need it. And that way you can have all the nice perfumes. And, okay, so that's how you keep it. Oh, so I'm going to say, quand y a l'oral nan mol la, la yo ba oti coupon yo ap kembe yo, ba vre? Bath and Body Works. Who love that place? Oh my God. Victoria's Secret? I get a free underwear every month. I'm not gonna miss that. That membership is hot. Combien nan nou ki gen yon membership nan Victoria's Secret? Mesye yo kam ki ap gade nou la, nou pa gen kat pou madame nou pou yal shopping nan Victoria's Secret? E pa secret, non secret. Ou sonje question nan? You remember your question? You can. You remember it? Yeah. Gon lot moun ki gon question? C'est Famoun? You have anything else to say? Because it's 9:10. Okay. Not just breast cancer, correct. Self-care as well. Mhm.
Hi everyone. So I understand Nutut say all of you guys are married women. Beautiful. Keep yourself together. What are your suggestions for single ladies on how do you manage if you want to get married, if you want to be a serious relationship with somebody? What are some suggestions on just how to maintain everything in America, right? How do you maintain having children? How do you maintain being a supportive wife to your husband? How do you balance all of that? So, question m'a gen, parce que m'ti toutes mesdames sa yo mariées, yo très belles, très jolies, qui conseil yo ka bay pour un monde qui jeune, tant que moi-même qui pas gen mari, but qui t'a vle ça, qui suggestion gen pour moi, pour comment pour ta mener mariage moi avec famille moi in the future. Thank you.
All right, we'll start with our sister here because she haven't spoken in a while.
Well, first, I would say enjoy your single life, girl. Enjoy it in the sense of praying and doing the things that you want to do as you are single, like travel and everything else, and getting to know yourself and getting to know what kind of person you are. Even counseling, therapy helps to know who you are. Because when you enter a marriage, it's two different people entering. So if you don't know who you are and you enter in a marriage so your husband could help you figure out who you are, it's not going to work out very well. It's going to be tough. So I would say that. I was single for a while. I just got married 2020. And one thing I love about my husband, he's super smart. And he always want to open a business or do some kind of business. I'm not really a business mind, but I support him in a sense of doing things that give him extra time to venture into those business. If it's cooking, cleaning, doing laundry, I don't mind doing that as long as I know he's spending that time to advance our family. You know, when he is able, he know how to cook. So when he does, he does. He know how to cook, clean. He have a clean business, so he know how to do all those stuff. But I choose to do it to give him a little more time so he could get that, you know, to do his business. I think it's a partnership when you get married. You both not gonna agree on everything, but communication is a big thing. That's one thing he taught me. Because I'm still learning how to communicate. So sometimes I think I told him something, but in my mind I told him, but I never told him out loud. Mm-hmm. So that's one thing, communication. If you have communication, everything will work smoothly. I know people may say like marriage is work. It's not work, honestly. It's more of you communicating and more of you like negotiating. Honestly, it's like a business negotiation type of deal. Like, okay, can I get this, or can we you know, can we move a certain way? So I would say that, and it's okay to date with potential of like being courtship, you know, not date just to date, la la land, but date to really know the person and to see, hey, is this a potential person I would love to be with? But not just date to date, just to go out, but date in a way that like, okay, I'm looking for a husband. So what quality, what value do I have? One thing I did know I wanted in my husband is a family man. He loves family, and I love my family.
Messieurs, Mildé, à font silence, s'il vous plaît.
So he loves family. So that's one thing I would not negotiate with. If a person have beef with their family, they can't deal or resolve it. It was like, red flag for me. So that's one thing. And I really prayed about it, because when I met him through a workshop. So not even through church. So it was a workshop. I met him. So, and he came to my church. So.
Second vie, est-ce qu'on peut bailler jeune un petit conseil en créole pour nous, s'il vous plaît?
Un conseil par moi, m'a toujours dit non, rester dans la prière, quitter bon Dieu choisi pour nous, parce que c'était vous même qui choisit à force pas, Marie ça a sorti un problème pour on dans Kaila. Si c'est bon Dieu qui bon Marie ça, la comprend nous très bien. Ou même en tant que fille, jouer rôle pas là et quitter Messie à jouer rôle pas là. Même si tu as fait plus gros l'argent passer Messie, la fait petit passer parce que Bible a dit c'est Maria qui chef maison ou c'est aussi avec Messie no matter what.
That's right.
No matter ça va faire si Messie mettez sous pour faire ça Messie a dit pour follow au monde parce que Messie a toujours c'est bon Dieu après bon Dieu c'est Messie qui vient ou même ou venir en bas pas pour soumettre mariage pas pour.
Thank you. Est-ce que nous gagnons un monde qui est âgé dans ça là? Parce que nous sommes jeunes qui posent des questions. Nous avons l'autre monde ou bien un garçon tout qui a une question qui t'a même posé. No. All right. So the thing I will be asking the panel, you came with anything on your heart that you wanted to share with the congregation? Maybe like Sister Maggie, she shared her testimony. Maybe one of you ladies have something special that you would love to share with the congregation that will bless them, that is memorable to you, or something.
Yes, I'll go.
Okay.
C'est à l'état de si on va gagner nous partager avec congrégation. Ça c'est fait nous mettre là son bagage qui est très important. It's very important parce que moi-même fait entrer dans vie 40 là. So, me songe année passée là, elle fait même programme ça, moi vini et puis pendant moi fait premier mammogram moi last year et puis pendant me fin faire mammogram là quand yo dit pour me faire un lot test encore. Quand pendant me fin faire là parce que yo dit yo pas clear, yo voulait faire un lot bagay quand I went back and I did another mammogram. Quand pendant même quand fin faire mammogram là, it's like I start having pain. I'm having pain under my arm. I'm having pain in the breast. And then so by the time Sefinoun had the program, I remember Mshita and I'm sitting there in pain. And you know, when you have pain and they're talking about these things, you're scared. And I'm like, and throughout the months I've been having the pain, I'm again, ma prière na kaila ti moun yo pa chaque fois ma prière quand yo vini mommy what's going on I'm just like oh, nothing has happened but I'm dealing with the pain. I can't even raise my arm. I can't even it was a weird experience, but the information the guest that they had last time gave, it seemed as if I had all the symptoms. And then not too long after that they asked me in your mind. Yeah, it's
was
like,
it in your mind?
I'm sitting there and then I came with because I'm the pastor's wife, so I came with a few ladies, and I'm like all over the place. I'm encouraging them and everything, but I'm sitting there. I'm like, Jesus, Lord, I'm gonna die. Please have mercy upon me. And I'm sitting there praying because every time he puts a slide, I had some of the symptoms that and then so, but I ended up having to do a biopsy because they thought that they saw something, and by the grace of God, it was nothing cancerous.
Right.
You know, but you know that's why, like, you know, tout le monde qui parce que m'te vinn font biopsy test nan sein and en bas boam too. So yo ouais ça pas gagné, mais ça fait là yo fait bagay programme ça yo li très important pour faire ça, and I encourage every woman to do every year do your well check. Chaque année fait check up là parce que là sou gen assurance ou pas payer un co-payment pour faire well check là. So sou pas gen assurance ou ka joindre surfer nous pour ka toujours envoyer moun va surfer nous relay hey somebody needs help something, you know, so ka faire well check up là et puis you know pour make sure you take care of yourself, because as women we take care of everybody. Toute femme,
Yes.
nous prenons soin de tout le monde. Même pour me faire appointment là, pour me faire mammogram non, pour me faire appointment pour test yo, c'est là me faire appointment pour tout le monde yo me songer myself. So think about yourself, prends soin de tout, fais check up et puis mettre la joie dans cœur tout. Dépression, some bagay everybody's dealing with depression, you know. That's a killer, you know, these days, mental health. You know, some bagay se fait nous toujours inviter l'église nous pour parler de dépression. Quand pile bagay qu'a vinn faire ou sad. A lot of depression that can really affect your health as well. It can affect the santé ou. So, sou ap di la kon bagay, pa potel pou kontou, jwen avek kon moun ou ka pale avek therapist, ka pale ak pizye moun, pou es kon moun ka jwen aide avec problem nan, pou ye jwen avek pasteur ou pou yansama avek li, e pale avek kon moun pa kembe tout bagay ande dan ke ou, pale avek kon moun pou es si yo ka edo, at least deal avek sa wap
That's
pase
right.
ya.
So, Sister Travell, you mentioned that you can help those who are U.S. citizen. We have a lot of people coming in. We have a lot of, you know, they don't have their working papers. They're not legal. If someone end up with cancer or they're feeling some type of symptoms and they approach you, how do you deal with those who don't have insurance? They don't have papers. They don't have an ID.
Well, we see everybody,
Okay.
whether or not they have papers or not.
Okay.
So the diagnosis or the screening and the diagnosis is not the issue. The issue is if they're diagnosed, because the Medicaid is only for U.S. citizens.
Okay.
So what we have to do is we look at local resources, and we don't let them go until they actually start treatment somewhere.
Okay.
Unfortunately, some of the hospitals have closed their doors to undocumented ladies, but we still have a few services out there. They may have to go as far as Moffitt in Tampa, but everybody gets into treatment. We don't let them go until they do.
Ok. Se pa paske ou pa gen assurance ou bien ou pa legal nan peyi ya, pou sou ta gon problem pou pe approche dam nan ou bien pou pe mande aide. Ap toujou gen aide même laissé pa département pal la, mais la ka référé ou à l'autre côté yo. Can you demonstrate, like if you're in the shower, how to check with one of the ladies?
Well, you shouldn't do it in the shower.
I was told that you should do it in the shower. Where should you do it?
Laying down,
Laying down.
and that is because that flattens out your breast area so you can feel better.
Okay.
In the shower, the soap, the water, anything you can slip and miss an area just by that. And
Okay.
because sometimes the lumps are really, really small, you don't want to do that. And you want to do it systematically, starting underneath your arm and go up and down, covering all the areas, but laying down.
Ça que fait me te poser la question ça parce que me songe me talon côté, yo dit c'est le wap ben pour lever mais pour faire, mais comme lui même il spécialisé dans ça, il dit c'est leur coucher qu'on y a leur plat ou coucher wap ka wè boule là bien. So she said she have a question. Okay. We have to close.
I remember last year when they had the breast cancer awareness event, so they presented, there was like a cell exam that you can do. They actually like give some out. So do you provide it like in clinics, or if like whoever wants to do it at home? It's not like a mammogram, it was like a paper thing that they put like over your breast and you could just do the
I know what you're talking about. We don't do that, and it's only because the Centers for Disease and Control and Prevention basically says it's not that valuable. What is more valuable is self-awareness, self-body awareness, and understanding what is normal and not normal for you. A lot of times when you do the self-breast exam, sometimes you don't know what you're looking for, or you don't even know what you're supposed to feel. That's why I wanted you guys to feel what a cancer lump feels like, the hardness of it. If that happens anywhere in your breast cancer, can start from your collarbone on all the way down to the level of your bra line. So most people just touch the mass part of the breast, but it actually is from the collarbone down. So the self-breast examination, again, what we now promote is just self-body awareness.
Thank you again, ladies. Nous disons tout le monde merci. Et nous croyons chaque année, nous toujours là pour genre des programmes ça pour nous capables d'informer. So tout ça n'a fait là, il fait partie de l'évangile là. Nous devons en santé spirituellement, matériellement, physiquement pour nous capables de servir bon Dieu. So merci en pile et ou même qui pour citoyen américain, c'est ça que fait les parler nous des fois faut nous tendre. Gain des bénéfices, yo pas pour vous. C'est pas que t'as voulu pour pas citizen, mais pays a une structure. The system works, but you have to make it work. So, Soup, you have another question? I'm going to turn the mic to Sister Famoun, and then she'll give it to you. It's very important. Okay, go ahead.
Ultrasound is what you use. That's the diagnostic tool. But an ultrasound is diagnostic. That means that you have a problem, that you feel something, and now you want to check it out. An ultrasound is not a screening tool. All right? So age 21 and older is when you're supposed to do your regular checks on your body, your breast. Okay? 18-year-olds, not necessarily promoted, but 21 years and up, you should have a clinical breast exam. That means you go to your doctor, someone who knows how to do that exam. Not all doctors know how to do a clinical breast exam. I'm sorry to report. But you have to, the doctor then is supposed to check from below the collarbone, underneath your arm, the entire area. Every year. That's where you start. And then you make sure you know yourself. You go to your doctor every year, and then if there's a problem, your doctor can order that breast ultrasound.
Amen. Anokapi. Dieu tout-puissant, comment qu'à considère tout l'univers créé par ton pouvoir, le ciel d'azur, les ciels d'azur, les éclats, le tout. Côté Corbeil là, côté Corbeil, prêtez-moi Corbeil là. Clair matin, ou les sombres du soir, de tout mon être, de tout mon. Alors, c'est le chant. Dieu tout-puissant, Dieu tout-puissant, I have yours. Que tu, moi prends une boy, de tout, moi, I have yours already. Alors, c'est le chant, Dieu tout-puissant, Dieu tout-puissant, que tu. Combien de gens qui ont ticket ça dans main? Tout le monde qui pas gagné levé main. C'est moi qui viens en retard. So it's a raffle. Petite film Viviana te la talea. So you get a free makeup or a free facial. Tout le monde gagne? Tout fille gagne? You have yours. N'a fait ça rapide. Qui l'autre monde qui pas gagne? Et nous connaissons comment facial la fête. De pour gagner, qu'on y a dit petit moyen qui a besoin facial là ou bien make-up là. C'est pas parce qu'on gagne aujourd'hui pour aller courir faire. Ou ka gagner un mariage dans mois ça ou fini. Ou capable gagner un event qui est très important. Qu'on y a ou même ou dit petit moyen mais tel jour mais tel là et puis qu'on y a ou faire. Okay, come here. Come, Vini. Yes. Oh my God. Which one is it? Wow. Ooh. Okay. Thank you. So I'll give you another one. Facial coûte cher, oui. On seul facial qui coûte $150. Ou a besoin ni gratis. Et vous pouvez patienter. Ok, tout le monde prend un ticket et regardez non mais. Oh, you didn't get yours? Yon make-up seulement pour faire qui coûte $150. M'dou la gratis. Et puis dans love le là, petite moi fait pour. Seulement pingo choisi maman seulement. Okay.
0292562.
Say it again.
0292562.
Gardez ti call non pour sou pas gain. 02 92 56 2. Pas gain qui gain? Okay. Give me that. Here. Okay.
0292545.
0292545. Oui. You have it? Zero two two nine 25. No, that's 54. This is 45. Mais ça me c'est à manquer passer sous moi. Who? Oh. 02 94. C'est ça. Quand y a ma bon 4 business petite moyen, quand y a ou même ou après l'el, là au besoin make-up là ou bien facial là. One more. Where the plateau? Okay. Here. Point l'autre. Faut nous prier avant d'aller. Okay. Let's go. Do you know numbers?
0292569.
0292569. 69.